morning, ma'am. I am Brumel Paolo Masutina and I will be your nurse for today. So, ma'am, for verification purposes, may I know your name and your date of birth, ma'am?
Maria Angela Matutina Carrito.
And how old are you po?
21.
Okay. So, today, ma'am, I will be assessing your genitalia. So, we will be performing an examination if there is any abnormalities on your specific body area. So, is it okay to you, ma'am?
Yes.
So, ma'am, is it okay to you to ask some few questions?
Yes.
So, ma'am, what is your first menstrual cycle, ma'am?
13.
What?
13 years old.
Okay. And, ma'am, when is the date of your last menstrual period, ma'am?
Last week.
Okay. And, ma'am, do you have any itchiness or pain in your genital area, ma'am?
No.
Okay, very good. So, ma'am, did you and no, did you notice any abnormal discharge or lumps in your genital or anal area, ma'am?
No.
Okay, good. So, ma'am, how about when you're urinating, ma'am? Do you feel any pain, ma'am?
No.
Okay. Oh, and ma'am, have you performed any sexual intercourse, ma'am?
No.
Okay, good. How about ma'am, fertility problems? Now and past. Your past now.
No.
Okay, very good. So, ma'am, we are now done on the your current symptoms. So, let us now go to the past history. And, ma'am, have you ever diagnosed of STD, ma'am?
No.
Okay, very good. How about ma'am, previous anal or rectal trauma
No.
or surgery now?
No.
Okay, very good. How about history of bloodstream, ma'am?
No.
Okay, that's all good. Now we are now done with your past history, and now we will go to your family history. Meron ba sa pamilya mo, ma'am, na nagkaroon ng reproductive problem, ma'am?
No.
Okay, very good. And ma'am, are you smoking po?
No.
Okay, very good. Ma'am, do you perform monthly genital self-exam po?
Yes.
Okay. Have you tested for any HIV test?
No.
Okay, so that's very good. So now, ma'am, we are now done on the. I am now done on the asking some questions. So, ma'am, let us now proceed to the physical assessment of your genitalia. So, okay to you, ma'am. So, ma'am, I will explain to you the procedures now. So, I will touch some areas and I will be inserting some of my fingers on your genitals, ma'am. So, is it okay to you, ma'am? This is for the examination. Okay, let's now proceed. Inspect the mons pubis of the patient and inspect labia minora and perineum for any lesion, swelling, and infestation. So we will now inspect the mons pubis of the patient, labia minora. Okay. And inspect the labia minora, clitoris, uteral meatus, and vaginal opening. Note for any lesions, excoriation, swelling, and discharge. So, on this part, wala naman siyang lesions or any abnormalities. So, next is palpate the Bartholin glands. So, we're now palpating the Bartholin glands of the patient for any swelling, tenderness, and discharge of the Bartholin glands. So, okay, normal naman siya. Wala naman siyang there's no any swelling, tenderness, or discharge. And next, palpate the urethra of the client by inserting this index finger into gloves and the index finger. Okay. Okay, so while palpating the urethra, I see no abnormalities on the urethra of the patient. So inspect the size of the vaginal opening and the angle of the vagina by moisturizing glove index finger with warm water and gently insert the finger into the vagina. So assuming that there is a warm water here and these are improvised speculum, so we will put our index finger to the warm water, okay, and gently insert the finger into the vagina, okay. Okay, so the size is normal. Okay, this is completely normal. And next, observe the vagina for musculature by keeping the index finger inserted in the vaginal opening and ask the client to squeeze around your finger. Squeeze around my finger, ma'am. So, okay, good. So, next, using middle and index finger to separate the labia minora and ask the patient to bear down and observe for bulging or discharge of urine. So, okay. Ma'am, can you please bear down to me, ma'am? Okay. And also, in the rectum of the patient. So, ma'am, can you please bear down again po? So, okay. So, while observing it, I don't see any bulges or any discharge of urine in the patient genital. In the rectum, I don't see any lesions and redness and any abnormalities. So now we are now going to perform a speculum examination. So we are now going to the speculum of the patient. So insert the two index and middle finger to relax the muscle of the patient. And here's this is the improvised speculum. So gently insert the speculum with like this. And be careful not to hindi matamaan ng mga pubis and skin ng patient or hindi ma-pinch ng speculum ang skin ng patient. Gently rotate the speculum. Okay. And unlock. And kindly open. Okay. Open. And lock the speculum. And using the pen light or the flashlight, inspect the cervix for color, size, position, surface, discharge, or any lesions or any abnormalities. So we now inspect the cervix of the patient. So okay. Okay. Wait. So okay. And after that, gently rotate and we will now release we will now close the speculum and lock it. And now gently rotate the speculum and gently remove it from the patient's vagina. So okay. So while observing the cervix of the patient is pink, also pink, and the size is normal. The position surface is, I don't see any lesions also on the cervix of the patient. So the cervix of the patient is completely normal. And next, we are now proceed to the bimanual examination by placing the non-dominant hand in the lower abdomen of the patient and inserting the middle and the index finger of the patient. By inserting the middle and the index finger into the opening of the vagina of the patient. Apply pressure posterior wall, waiting open to relax. Then palpate the ovaries and the uterus of the patient. Okay. We'll now palpating the uterus and ovary of the patient. Okay. So, when palpating the uterus of the patient and the ovaries, it seems normal naman siya. The shape and size, and no tenderness, mobility, and masses, no masses also, and any abnormalities. And next, we will now change the gloves for the rectovaginal examination. Okay. Okay. This is the new gloves. To be inserting the middle finger and the index finger. Pero ngayon, ang middle finger natin ay nasa anus ng patient, sa rectum niya. And ang index finger ay nasa opening of the vagina. But first, we will now add a lubricant or lubricate on the gloves. Okay, so nalagyan na natin. And gently insert the two fingers in the index is in the vagina, and the middle finger is in the rectum of the patient. So ask the patient to bear down. So, ma'am, can you please bear down for me po? So, okay. We are now palpating the cervix of the patient, the rectovaginal septum, and the posterior uterine wall. So, okay. And it seems normal now. So, and after that, we will now proceed to the anus and perianal area. And now, let us now palpate the rectum or anus of the patient. So, we will now palpate for any sphincter tone, tenderness, nodules, or any hardness of the anus of the patient. So kung kaya mo i-rotate ng clockwise and counterclockwise for palpating the anus of the patient. So, okay. So, and after that, gently pull out your middle finger. And if the patient has a brown feces, so it is normal. So, okay, the findings are normal. So gently assist the patient para tumaya. Yeah, so ma'am, we are now done on your assessing, ma'am. So the findings are, when assessing the cervix and the genitalia, so overall they are normal, and in your rectum also there is no problem and completely normal. So overall, when assessing your genitalia and rectum, it all normal. So wala namang problema sa genitalia and rectum nito. Lahat po sila normal. So that's all, ma'am. That's all for the assessing the genitalia and rectum, and thank you.
Thank you.